We tend to think that in OCD, the main emotional experience is anxiety. This is generally true. The false sense of danger created by obsessions provokes fear in most people. However, the disorder may attack you from different emotional angles. In this video, I will clarify how another unpleasant feeling may be induced by intrusive thoughts and images. I'm also gonna provide you with a powerful tool to fight back that nasty bully called OCD. My name is Dmitry, and I'm a psychiatrist, CBT, and schema therapist. Stay tuned as we delve into understanding subtle nuances of OCD treatment. So, the second most common emotion provoked by obsessions is shame. Like anxiety, shame is a consequence of the overemphasis we place on repugnant thoughts. In the first case, for example, you attach a high importance to the thought that your child might be infected with rabies, resulting in you being afraid of external threats. These are typical anxieties about obsessions regarding pollution, contamination, and the safety of property. Or you may suspect sexual attraction to your sister, in which case you feel not only fear that these thoughts will be realized, but also the shame of having such thoughts at all. This emotion will be more pronounced with such taboo topics as sexual orientation or harm. Fear makes you scan the world for threats and try to avoid them, and shame fuels the feeling that there is something wrong with you. It also makes you feel like your thoughts are so important that you can't tell anyone about them. It also makes you avoid self-disclosure. This, in turn, makes you more isolated and withdrawn. Hiding obsessions can be a burden because it is hard to carry around for years something that makes you feel like a weighty, unsightly secret to you. In psychotherapy, much of the effort during sessions with my clients is put into normalizing intrusions. Because the more neutral you perceive unpleasant thoughts to be, the less power they have over your feelings. The less embarrassing they seem to you, the healthier you perceive yourself to be. So what can we do to reduce the burden of these experiences? Continue to hide them away? No. Being able to share the fact that you are having obsessions, and sometimes their content, with the right people can provide a powerful sense of normalization of what is happening to you. A patient of mine, let's call her Maggie, was obsessing about her possible homosexuality, and like most people with OCD, kept her intrusive thoughts secret. She met a girl at a party who seemed like a gentle, open-minded person. Maggie spontaneously decided to tell her about her intrusions regarding her sexuality. The new acquaintance responded with many words of support and understanding. She thanked Maggie for her courage and offered her friendship. She also said that she herself had such thoughts from time to time and that she did not attach any importance to it. This turned out to be a game changer for Maggie. After that, she began to gradually open up to more people. She published posts about OCD, and later, on OCD Patients Day, she announced that she had that diagnosis and received many words of support and encouragement from people she knew on social media. Of course, such actions require a lot of bravery and they involve taking some risks. Some people might actually think you are weird. I would not routinely recommend confessing your thoughts to people you do not trust, but opening up to at least a few people in your inner circle is an affordable and liberating first step. You may belong to that group of people who have the opposite neutralizing strategy. You may think, I am an abnormal person, but I have the responsibility to inform other people about what is going on in my mind. They need to know what I am really like. The implication is that they need to know how awful I really am. They have to know this before they engage in any relationship with me, because otherwise it would be dishonesty or even betrayal. This rule emphasizes the overriding importance of mental intrusions in exactly the same way, and this can become a self-fulfilling prophecy. Let's say you are spending time with someone you like, someone you might want to try to develop a romantic relationship with, and you have this idea in your mind, they must know this about me. And so on the first or second day you say, I need to tell you something important about me. I've been having thoughts about killing people. Such tone and timing can really repel a person because it actually conveys a false idea that something is wrong with you on a deeper level. A sound strategy would be to gradually self-disclose. The first step is to find out how the person generally feels about emotional and mental issues, for example, how judgmental they might be. Next, you can let them know that you're having some difficulties with anxiety. Anxiety is not a socially condemned topic. It is perfectly natural to talk about it. After a while, you can say, "Remember when I told you about my anxiety? It would be important for me to get your support on this." Most people willingly and eagerly get involved in helping others, especially those that are close to them. You can ask them, "Would you please read this article about what OCD is?" and send them some text that goes over the mechanisms by which intrusions are transformed into obsessions due to overimportance allocated to thoughts. Then you can discuss with them the fact that you are having OCD, for now without directly specifying the topic the obsessions revolve around. Once at this stage, you can begin to get support and normalization, and after that, when you feel ready to share the content of your obsessions and your friend's interest in hearing them, you can discuss that as well. I'll give you another example of self-disclosure to demonstrate that this deed may be beneficial to both sides, not only to the person who shares their internal struggle. Daniel suffers from contamination issues, due to which his daily life is affected by massive avoidance and multiple cleaning compulsions. His house, as a result, resembles a garbage dump. He's got a friend, and this person is informed that Daniel has some issues he works on with a therapist, but without any further details. And Daniel's friend has physical health issues due to his lifestyle, and excess of alcohol and junk food led to diabetes, heart disease and obesity, which in turn caused gradual joint deterioration. He has a bunch of exhausting maladies of which he feels helpless against. The more helpless he feels, the more he binges on food and alcohol, dragging himself down into a typical vicious circle. And one day, Daniel's friend announces that he doesn't want to live anymore, that he is too tired of confronting his own body, which is falling apart. And for Daniel, this is the best and only friend, and there is no way he gonna accept the idea that his friend will commit suicide. So Daniel decides to put his shame aside and to reveal the whole story of his struggles with OCD to his friend, with all the icky details of the downfall he experienced for years and the grueling exposures he had to undergo to reclaim at least a semblance of a normal life. And this way Daniel managed to make a massive impact on his friend's attitude towards his own health. From that day on, the friend began to exhibit more commitment to maintaining a much healthier lifestyle, from quitting alcohol to seeking appropriate medical assistance. In turn, Daniel received more support, gratitude, and admiration from his friend. That story depicts the notion that your courage in self-disclosure may be so powerful that it can even save someone's life. This is the path of exposure to shame. It might be even more demanding than standard exposure to anxiety. But hey, who promised you that fighting your internal demons would be easy? It never is. So I wish you resilience and bravery while walking this path. See you in the next video.